focused on the internal iliac lymph nodes, their drainage areas, cervix, proximal vagina, prostate, inferior bladder, lower rectum, and relevant conditions including differentiation from superficial inguinal lymph node drainage in cases like ST and cellulitis. Question 1. A 66-year-old man presents with difficulty urinating and lower back pain. Digital rectal exam reveals a firm, nodular prostate. PSA is elevated and biopsy confirms prostate adenocarcinoma. Which lymph node group is most likely to be involved in early lymphatic spread? A. Para-aortic, B. External iliac, C. Internal iliac, D. Inguinal, E. Inferior mesenteric. Correct answer, C. The internal iliac lymph nodes drain the prostate, inferior bladder, and pelvic organs, making them the first site for prostate cancer metastasis via lymphatics. Why not the others? A. Para-aortic drains testicles, ovaries, kidneys. B. External iliac drains superior bladder and uterine body. D. Inguinal, skin of perineum and anal canal below pectinate line. E. Inferior mesenteric drains left colon. Question 2. A 30-year-old woman presents with postcoital bleeding and malodorous vaginal discharge. On pelvic exam, a cervical lesion is visualized. Biopsy reveals squamous cell carcinoma of the cervix with involvement of the proximal vagina. Which lymph node group is most likely involved? A. Inguinal, B. Internal iliac, C. Inferior mesenteric, D. External iliac, E. Popliteal. Correct answer B. Internal iliac. The internal iliac nodes drain the cervix, proximal vagina, corpus cavernosum, and inferior bladder, and are thus first involved in cervical carcinoma spread. Why not the others? A. Inguinal drains vulva and distal vagina, not proximal. C. Inferior mesenteric colon, not genital tract. D. External iliac may be involved, but internal iliac is primary. E. Popliteal drains lower leg. Question 3. A 40-year-old man presents with painful rectal bleeding and tenesmus. On anoscopy, there is a mass in the rectum above the pectinate line. Biopsy confirms rectal adenocarcinoma. Which lymph node group is first involved? A. Superficial inguinal, B. Para-aortic, C. Internal iliac, D. External iliac, E. Inferior mesenteric. Correct answer, C. Internal iliac. The lower rectum above the pectinate line drains to the internal iliac lymph nodes. Thus, they are the first site of nodal involvement in rectal cancer at that location. Why not the others? A. Inguinal, below pectinate line anal canal skin. B. Para-aortic, drains gonads and fundus. D. External iliac more associated with superior bladder. E. Inferior mesenteric drains upper rectum and descending colon.